Hi, I'm Dr. Neil Schultz, and welcome to the November 2013 episode of BeautyRx Live, where over live streaming video, I'll bring you information about BeautyRx skincare products. These are the same patient-proven and award-winning products that have been giving my patients younger and more beautiful-looking skin for over a decade. Today you'll have a chance to ask me about specific products or even how to use different products, or maybe some of your individual skincare needs as they relate to BeautyRx skincare products. While BeautyRx skincare products address the ageless issues of color and texture, we of course know that lines and wrinkles are important. But the value of these products is that they're based on the principle of exfoliation, and while we stress the 3 daily skincare ingredients of sunscreen, exfoliants, and antioxidants, the single most important thing you can do on a treatment basis, on a regular basis, to get more beautiful and younger looking skin is to exfoliate. Of course, the single most important protective thing you can do is use sunscreen every day. So if you have any questions, please go to BeautyRxLive.com, use the chat box, and I'll get to as many of your questions today as I can. Again, this is Dr. Neil Schultz, and welcome to BeautyRx Live. Here I have a question today from Alana. I have acne. Can I also use a moisturizer? If so, what type? Alana, sure you can use a moisturizer, particularly in colder, drier weather. And the function of a moisturizer for you is probably going to be to treat dryness. And you would know that your skin is dry if either you see flaking or you feel tightness, particularly after you wash. You want to use a moisturizer, which of course is oil-free or water-based, such as the BeautyRx Light Rehydrating Lotion. And the reason for this is because it will help moisturize your skin without adding any oil, which of course you can't afford to with acne. It'll moisturize your skin. It's oil-free, it's water-based, and it will go a long way towards giving you the moisturization you need to fight that dry skin. I have a question from Jocelyn. I know you've always recommended glycolic, but what about Retin-A? Why glycolic over Retin-A? Jocelyn, Retin-A was the only exfoliant we had in the late 1980s, and I was very happy to have it. It was the only effective chemical exfoliant, but when glycolic came along, because it is so much more versatile and it is less brittle, which means so much less irritating. Retinoids tend to cause irritation if you use a little bit too much or a little bit too strong. And we have such a wider therapeutic range with glycolics, from 1% to 20%. Retinoids have a much narrower range, and there isn't a week that goes by when I don't get a few questions from Derm TV viewers about retinoid irritation. Retinoids require a prescription, and you really can't rely on over-the-counter, non-prescription retinol to be turned into an effective exfoliant inside your skin when it's absorbed. So, for an awful lot of reasons, but mostly because glycolic is more effective, not irritating, and I believe it's not only the gold standard of chemical exfoliants, but today it's the platinum standard. It's gotten to that point. Karen asks, is there a special type of sunscreen I should use when I'm out in the snow? Karen, that's a great question. Nobody's ever asked me that before. Actually, in the snow, the sunlight, the UV, is reflected right off that snow, so much more than it's reflected off of sand and ground. It's a little bit like being on the ocean. So I believe that chem-free sunscreens probably work a little bit better than traditional carbon-based sunscreens. And while in the BeautyRx skincare line I have 6 different sunscreens, 2 of them use the physical sunscreens found in chem-free sunscreens, such as chem-free solar protection 30, as well as maximum solar defense sheer cream 50. So these are the sunscreens in the BeautyRx line that have physical reflectors, whether they're titanium or zinc, which actually reflect the light off your skin, so the ultraviolet never gets into the skin where it can cause damage. So again, try chem-free sunscreens if you're going to be out in the snow, and especially if you have sensitive skin. Again, I'm Dr. Neil Schultz. This is the November episode of BeautyRx Live, where over live streaming video, I can answer your special and specific questions about BeautyRx skincare products. If you have a question, just go to the BeautyRxLive.com, go to the chat box, and I'll get to as many of your questions today as I can. Carl asks, should I be taking a vitamin D supplement since I'm no longer in the sun in the cooler weather? Carl, yes, you should. Now, it's controversial as to whether or not all of the alleged deficiencies in vitamin D, according to laboratory tests, are real. But the reality is that with our respect for the damage that ultraviolet light causes, and therefore as a result of sun protection and sun avoidance, we probably don't make enough of our own vitamin D. So for sure, you should be taking supplements, whether they are actual individual supplements or whether they are just vitamin D enhanced foods like fatty fish and milk, which is actually enhanced with extra vitamin D. So by all means, do take a vitamin D supplement. Mary asks, I started using an exfoliant, not BeautyRx. That's okay, Mary. There are lots of good other skincare products out there besides BeautyRx. I started using an exfoliant and now my skin is peeling. That's not good. I want to switch to BeautyRx, but what should I do about the peeling? Mary, I would start with compresses of equal parts of skim milk and water, room temperature, for a few minutes on a soft cloth like a handkerchief or t-shirt material. And you can get some aloe vera or even an over-the-counter 1% hydrocortisone cream to apply after the compress to take away the peeling and the irritation. And you should use an oil-free water-based moisturizer like the light rehydrating lotion I mentioned before, because it has no oil, for 2 or 3 days until all of that peeling goes away. Then just continue with the moisturizer for a few days and then start the BeautyRx Daily Exfoliating Therapy Serum, which is an 8% product, just a few drops to your entire face, only once a night after you've washed your face. But of course, make sure all of your peeling and irritation has cleared up. Georgina asks, my daughter, who's 13, is just getting into skincare. Can she use an exfoliant? Of course she can. What is the best product for her to use? Well, if at 13 she's in puberty, so she's making some oil, and it's time to make sure that an exfoliant is preventing clogging of her pores, an 8% glycolic product, an 8% serum, which of course is what we use for acne-prone or oily skin, would be the place to start. One of the reasons that the BeautyRx Daily Exfoliating Therapy Serum is so effective and so successful is, number one, it's so easy to use, 3 or 4 drops just once a day, and they set and dry immediately. It becomes sheer and invisible. It never clogs, and it's very, very effective without being irritating. I would probably start her, since she's 13, only on alternate nights, and after a week or 2, then have her progress to using it every night. And this is a good time to teach her that exfoliation is a maintenance process for her skin, just the way brushing your teeth and flossing your gums is a maintenance process for oral care. Exfoliation is a maintenance process for skin care, as of course we also should include sunscreen. Sarah asks, if I use an exfoliating body lotion, do I need to put another moisturizing body lotion on top? Sarah, it depends on what type of exfoliating lotion you use. So if the exfoliating lotion also is a moisturizing lotion, then you probably don't need to. The BeautyRx Daily Exfoliating Body Lotion, which is a 10% glycolic, is not a moisturizing lotion. We tried to keep it pure. We tried to have a single focus here because we wanted the exfoliant to spread easily and to be effective, so it would be more easy to use. In that case, if you're using the BeautyRx product, you then would add a moisturizer on top, and you could use the BeautyRx Daily Hydrating Lotion, which is an excellent moisturizing lotion for the body because, again, it spreads easily, goes right on top of the 10% glycolic product, but in addition, it has humectants in it to really hold on to moisture. Ashley asks, my knuckles crack every winter. How can I prevent this? Ashley, the reason I'm smiling is because the reason we started a little late today is because I got detained with a patient who had the very same problem today And she's the third person this week to come in with this problem, and I suspect that it has to do with the fact that we've had much colder, drier weather this week in New York. Now, in all fairness, usually when people get this knuckle irritation, they tend to be people who wash their hands a little bit more often than perhaps they need to. So we find that people who wash their hands extra times and are exposed to irritating soap tend to develop this. The best treatment is, first of all, try to cut down on what's causing it, which is both stripping of the skin by too much exposure to soap and dryness from cold weather and dry air, which of course requires a moisturizer. But in addition, for the actual redness, which is inflamed skin, which has occurred as a result of all the water loss, you probably want to use an anti-inflammatory like a topical over-the-counter cortisone ointment. And you can get a 1% hydrocortisone ointment over the counter. And I would use that for 2 or 3 days, a couple of times, in addition to moisturizer. And if that doesn't take away your redness, then you may need to see a doctor or dermatologist. But I bet you that by cutting down on the amount of exposure to soap, by using a low-potency cortisone in an ointment vehicle and using a moisturizer, that's going to clear it up for you. So again, I'm Dr. Neil Schultz. This is BeautyRx Live over live streaming video. We're bringing you answers to your questions about general skincare, BeautyRx skincare products. If you have a question, please go to BeautyRxLive.com and just go to the chat box, put in your question, and we'll get to as many as we can. Tanya asks, is there anything I can do to take better care of my nails? Tanya, the best advice I can give you for taking care of your nails is to protect them. And the way you protect them is with nail polish. But the problem with nail polish is when you take your nail polish off, you often use a product that strips the cuticle, which is the covering of the nail, just the way your epidermis is the covering of the skin. It sort of strips that cuticle, and that then can lead to problems with either brittle nails or soft nails or nail breaking. So, how do we do that? We find a nail polish that you can layer on top of itself without having to remove the underlying polish on a regular basis. Usually, clear nail polish is easier to do this. So, instead of putting on taking off your polish every week to apply fresh polish, try layering polish every week for 3 or 4 weeks and then removing it. So you're only using nail polish remover 1/4 of the time. You're still protecting, you're stripping it less, you're putting chemicals on less often that tend to weaken that cuticle, and that is the place to start. And there are a lot of products on the market which are called nail hardeners. You could use those instead of the polish, or use a nail hardener after you've stripped the polish and then put the clear polish on top. Melissa asks, what skincare regimen should I use for this cooler weather? Melissa, in the cooler weather, we all need to use heavier vehicles. Heavier vehicles mean if you're using a lotion for your active ingredient, maybe you'll move up to a cream. And when I say active ingredient, we could be just talking about moisturizers. But also, your cleanser. Maybe you need a less harsh cleanser because with less heat and less humidity, there may be less oil accumulating on your skin to remove. So you might want to use a more gentle cleanser and toner, a more potent or a heavier or thicker, but not containing oil, more potent moisturizer, and the same thing applies to all of your skincare products in terms of changing the vehicle. Whether we're talking about glycolic, antioxidants, peptides, any of these products, they need to be put into, you need to buy products that have them in heavier vehicles. And they're all available because all of these actives are made in lotions, creams, ointments, and so on. Okay, I'd like to take one last question today from Harriet. And Harriet asks, are there any dermatological procedures I should avoid getting in the winter? What an interesting question. Harriet, I can't think of any procedures that the winter is a problem for. I can think of lots of procedures where the summer is a problem in terms of the healing and sun exposure, where you could get some post-inflammatory hyperpigmentation in the summertime. But in the winter, I would say not. Just bear in mind that any procedures that are done which involve breaking the epidermis, whether it's laser resurfacing or other procedures, you just are going to have to work a little bit harder at using a moisturizer to cover the damaged skin, to avoid evaporation of your natural moisture and fluids so you don't get over drying of the skin. And that's really the only thing I can think of. And isn't this nice? I have a comment from Mary. Thank you for your time, Dr. Schultz, and happy holidays. And to my whole BeautyRx community and Derm TV community, I'd like to wish you all a very happy Thanksgiving and happy holidays to you as well.